Omkar and Avni, they were really good questions. And they sort of inspired me to think a little bit more and link it also with the big question that Purnima asked me to think about, and I think asked all of us to think about, which is, you know, who goes to whom when you're looking for evidence. And so I'm going to try and give a consolidated response and then hand it over to my colleagues. First, the NCA, your question, Omkar. So I think we have to agree that there are different kinds of evidence. And in almost everything that at least 3IE does, we ask our researchers to espouse what's called our preparation phase. So even in many of our grants, actually they don't come to us with a question. The agency or the organization comes to us and says, well, we think we are interested in, you know, something evidence-based policy. And it's really, in many cases, it's quite nebulous. That's one of the modalities that we work with. And then we researchers work with them very closely and identify questions that may be useful to that organization or to that department. Even after having done that, they then have to go through a pretty rigorous or a formative or what we call a preparation stage, during which they have to then assess the condition of existing administrative data, big data, rapid data, open data that may be available that they can then use. Of course, as a researcher, you'll probably recognize in many cases they just don't find the data good quality or relevant, and you know there's no metadata. What do you do? So then there are those sorts of second-order questions. But clearly, having assessing that is very important and something that we require. Avni, to your question and also to Purnima's question, I couldn't agree more. I think we have to change the name of the stuff that we do. I think we have to call it something which is really cool and, you know, interesting and sexy, and, you know, so it shouldn't be called evaluation or impact or something. We should just call it, I don't know. We're here to help you. Yeah, something. But and I think it really helps. Re-christening this thing does really help. I mean, I think we probably all have examples of this. I remember I was working at Columbia, and I was working with someone who I will not name, and they didn't like log frames. So I started to say, well, okay, but you know, we are a whole herd of scientists and we are working on a big multi-country program. So we have to have something that makes us understand what the design of this program is. And I changed the name of that, you know, having a system to just calling it impact pathway. And they liked it, and we went ahead. But changing the name really makes a big difference. So yeah, I mean, we have to be bold, and we have to think creatively, so I'm all for that. I think there are many questions that when we are thinking about, when we're thinking about supporting evaluations. In India, for example, the government of Kerala said they wanted to look at MMR and IMR, and they were introducing a new protocol. They didn't know whether it would work or not. We had a team, and that team was ready to go forward, work very closely with the government of Kerala, and you know, designed the impact evaluation around the questions that the government of Kerala wanted, and that's ongoing now. Several other examples, IPMS, etc. So looking at project management systems, what works, what doesn't, audits, what works, what doesn't. I think, again, we have to think in bold new ways. When the example is a little bit different, but we are talking to the big humanitarian community, and they are, you know, far removed from the area of impact evaluations. But one of the examples that one of my co-authors came up with was the example of the National Health Service in the UK. And the big problem with doing very quick, rapid impact evaluations in the humanitarian world is that you don't have baseline data, you have ethical concerns, you can't go into the field quick enough, you're just concerned about whether you can get evidence quickly enough. The NHS actually as a system, they find that there's an epidemic, they have a team of scientists ready, they fly them in 24 hours, they go do their data collection, come back just so that they can diagnose the situation. Yeah, and they don't have any medical authority or function. So we have to think in ways so that we can be rapid, quick, decision focused, and cater to the community out there rather than them coming to us.
Great, thank you.
Okay, I'd like to respond to the question about the role of national surveys, national household surveys, and I think, of course, national household survey, nationally representativeness is very important. Without that, we cannot find out the trend in poverty. We cannot find out the trends in undernutrition and all those things. So those have to be based on nationally representative surveys. I mean, small, impact evaluation surveys cannot do those things, right? Also now, coming to our, again, Bangladesh experience, these national surveys also could be tailored a little bit, not much, because these are huge surveys, very expensive. But what in Bangladesh the government did is they added all the safety net programs, who is participating, who is getting benefit. So now we know that two things we can get from there, because this national representative surveys also, we get this household consumption, that is expenditure, and that is helpful to look at the targeting effectiveness of the safety net programs. And the other is coverage. So which program is covering how much. So for that you need this type of surveys. The other thing that was also done in Bangladesh, which is nationally representative household income and expenditure survey combined with population census. Every 10 years, Bangladesh does population census. The latest one was in 2011. So combining these two, what is called this small area estimation, right? So you have some common indicators in the population census, you have some common indicators in the household survey, and then using both, then you can target very small areas, like in Bangladesh, at the union level, there are about 6,000 unions in Bangladesh. So that targeting can be done for social programs. So for that also you need this national representative survey. The third one that was also now is being developed in Bangladesh is using this national representative survey and also the census. First, the nationally representative survey was used to develop proxy means testing, number of indicators, about 18 indicators. So those indicators will be used with the census data so that every household theoretically can have one score, poverty score. So again, very important for targeting. So I think these are some of the ways I think nationally representative survey could be used more with slight changes.
Great, thank you. Jasmine, closing again.
So I think I'll merge my closing comments with a response to Avni from UNICEF. And I think I couldn't agree more on the fact that there is a real gap between the research and the policy community, right? The cycles and the need and the patience to, how much can you wait for answers? So that is a reality. Now, what can be done about it? I think at JPAL we are constantly thinking about it. And nobody, I think, can claim, because there's an academic failure, as one of the earlier panelists also put it. One thing that we've realized, and I think goes back to Nell's point, that researchers either sometimes don't have the time, or maybe even the skills to continuously engage with policymakers in a way that there is some element of trust that is built, so that they can rely on them for either giving them answers based on evidence, or requesting them to take up a study at short notice. And at least at JPAL, our response has been to strengthen the policy staff that we have. We have a fairly large policy team globally and in regional offices, And the idea, apart from disseminating past research, is actually to build some of these relationships so that, the moment we have built some amount of trust, that a person can at least call upon us if they have a question, and then we can respond, or we can reach out to our network of affiliates. I think one of the strengths at JPAL we have is we have a very wide network of affiliates, over 120 and growing. And when you merge all their research interests, you actually are able to get one or two people who can respond. It's just that what process do you deploy to then communicate both ways? But even when you have mobilized and you have mobilized or identified a researcher who can work on it, then the next question is, how do you get the research study started? And I think there it goes back to the commitment of policymakers. As in my experience, our experience has not been so good in terms of, yes, they may demand research, but at the time you also need to have an appetite to fund some of that research if that answer is so important for you. And as Nell says, why do we then have to go to an international donor if you are so bothered about this answer? I must say that in India the biggest success we have seen is with the Tamil Nadu government, and over the last 2 years I think they have put in a few $1 million of their own state fund to fund research.
That's fantastic.
And it's taken a lot of time, not just from JPAL, but I'm sure they're engaging with other organizations as well. But then even for external donors, especially when you're working with governments, the time at which you can deploy money, provided the partnership is very serious or the policymaker is very serious, has to come down. And I think that's the only way we can turn this around. And I think the final point is, yes, I think as a research community, we should be more introspective than pointing fingers, but there is a real gap in terms of, from the policymaker side, understanding the time it takes and the care it takes to produce careful research. And you can't be demanding answers tomorrow and say if you're not, so that's, I think that doesn't help. And it's a very slow and gradual process, I guess, but I can say that, we, ending on an optimistic note, we do see, I think with every passing year, there are more and more people within the system who care and who want to work on this kind of, working through evidence to take decisions.
Great, thank you so much. Those were really, really great remarks. Now, over to you.
So yeah, thank you. I couldn't agree more that policymakers, managers, etc., are demanding more evidence. That's definitely the case. I think, though, there's also now a growing appetite everywhere for a process, a mechanism, an institutionalized process for assessing that evidence that's more neutral, transparent. As middle class grows and becomes more vocal and demanding of public spend and getting the benefits from that public spend, particularly in health, we're actually seeing a growing appetite for processes to assess what makes most sense to fund publicly, particularly around expensive technologies. And I think this is the beginning of the movement in India. So we actually saw at the end of the last government, the Medical Technologies Assessment Board announced under the previous secretary, ICMR. That's been quiet for a bit, but the new director of ICMR, who's clearly a star, is very excited about building up this function. At the moment, it's rather narrowly defined on medical technologies, although that's huge. But of course, but it's now, in terms of the wider social policy agenda, it's quite narrow. But I feel it represents, and her appetite to learn from international experience on how that transparent, independent, but close enough to government mechanism might work, that involves stakeholders, industry, civil society, researchers, on looking at the evidence, looking at the gaps, looking at the costs and cost effectiveness, the benefits. I just feel there's a great space opening up to actually look at how research and evidence is used in terms of responding to demands. And it's driven by the need for value for money. It's also driven by consumers, citizens, who want better value for money. So part of the challenge is going back to this electoral political market. So it's not just the middle classes getting decent health services, it's actually thinking about the wider political market around, what makes most sense around social protection schemes, just to come back to the loop.
To the theme,
Yeah,
yes,
yeah.
great.
Thank you.
Thank you so much. So many thanks to all of you. I did ask Manny if he would make some closing remarks for us